Have you heard about this personal and professional podcast?
Coaching in Session with your host, Michael Rearden.
Santos, Coaching in Session. How are you doing today?
Good. Thank you for having me, Michael. Pleasure to be here.
Of course. Today we're going to be talking about your work, foot and ankle specialist. And I love having health professionals come on from all different aspects of work, whether it be working on the brain, working with adults, or maybe only children. But today we have something unique. We're going to be doing something that many people take for granted, the ability to walk unrestricted. And I know some people, they might be confined to a wheelchair, maybe a walker or a cane. And when they were younger, they probably never thought of being in this situation or circumstance, but now is part of their daily life. So they have to navigate through it. And so today we're going to be talking about your work, and we're going to be maybe even looking at some preventative measures that people can be taking today so they don't fall into that lifestyle later on. But in your own words, can you tell the world who you are, what you do, and how you help?
Yes, of course. I'm Dr. Roberto De Los Santos. I was born in Los Angeles, but I moved to Houston, Texas when I was 2 years old. I grew up here, went to middle school, high school, etc. Went to undergrad in St. Mary, San Antonio, Texas, majored in biology. At that time, I was kind of didn't know which route to go. Full circle, I shadowed foot doctors, foot and ankle specialists known as podiatrists, and went to podiatry school in San Francisco. So I was out there for 4 years, did my surgical training, what's called residency, here in Kingwood, Texas, which is northeast of Houston. And that's who I am, and I'm back in my community trying to help where I started.
Was there anything growing up that kind of gave you direction to what you wanted to do, especially helping people with their movement and their feet?
So I shadowed many different aspects of medicine, primary care, orthopedics, physical therapists. When I shadowed podiatrists, it seemed like a very relaxed 8 to 5 job. It almost felt like I call it a barber shop, where he was working on the foot and ankle and talking to the patient, getting to know them. How's your family doing? How's the kids doing? Are they in college? Oh, wow, he's already all grown up. It was a very close-knit family. And then what really made me fall in love was the surgical aspect. So I saw a very simple surgery. It was a toe amputation, and that just blew my mind. I didn't know that you can do that as a podiatrist. And since then, I shadowed every summer, and now I'm back doing exactly what I shadowed when I was in high school. So I guess the ability to talk to the patients, connect, see their whole family, do surgery, and have a relaxed environment.
Would you say when you were younger, I'm going to be a foot doctor, like you knew 100%, or is this something that you fell in love with later on in life?
So growing up, I did have a grandmother who lost her limb due to diabetes. So this was in elementary school. I always remembered noticing, I didn't know what I was seeing, how it happened. I just knew that she had some sadness in her face. She wasn't happy anymore. Something has changed. She was in a wheelchair bound. As a little kid, you try to make the best as understand, but now as an adult, I realize diabetes, if not taken controlled or early initiative, if not educated properly, it can lead to a wound, an infection, surgery, amputation, higher. So from a little kid, I knew I wanted to help people not have that happen to other people like it happened to my family.
Yeah, but typically when people do their purpose in life, like they find something they love, it comes from when they were very young. It was almost like a calling that kind of hit them, and they were like, okay, this is something I want to fight for. I want to help educate people on this. I want to, make sure this doesn't happen to everyone. And so doctors do a great job at this in educating their patients and clients, saying, hey, if we don't want to get worse than where we are today, let's start to do some preventative measures. And I'm gonna use my least favorite doctor, a dentist. My least favorite doctor, right? It's not that I don't like them, right? I just don't like the fact what they do to me sometimes. Like, I need a root canal. Like, thank you, doctor, for saving my life. But at the same time, it's like, ouch, this hurts. Well, if I do the right thing, right? If I go brush my teeth 3 times a day, floss like I'm supposed to, no issues. But when you're a kid, and, for me, I grew up in the ghetto. And so, hygiene was the last of my concerns. And I would just eat candy and do things. And I had cavities probably every single time I went to the dentist until I was an adult. And then I had no cavities. I go to the dentist, is like, you have wonderful hygiene. I'm just thinking in my head, like, why did I not do this when I was younger? Right? It's so simple. It's so simple, stupid, but I didn't do it. Maybe it's because I was ignorant, maybe because I was uneducated, or maybe it's because I just wanted to go play outside and play video games and not focus on something that, I didn't fully understand would have a huge impact on me if I didn't take care of myself. Because I know people who are in their 30s who have lost all of their teeth already because they didn't take care of them. And I know people who are in their 30s who can't walk because they didn't take care of their body, whether it be because of diabetes, or whether it be because they weren't going to the gym. Something along the path, there was some type of discrepancy that caused them to fall into that circumstance. How can we create a life or an upbringing where we start to educate children at a younger age to start to look at these issues that can affect you later on as an adult? Because as I said early on, when you're a kid, you're worried about every other little thing besides your health, because you can do the cartwheels, you can do the flips. And then eventually at some point you're like, I'm not going to do a flip, I'm not going to do a cartwheel. So going back to the education aspect, how can we start to educate the younger folks and the next generation to come?
So before I answer that question, what is the average person you think is aware that they are diabetic? So me growing up, I would say, okay, somebody in their 40s, 50s, that's when it hits them, right? You've been diagnosed, you've been tested, and this is what you have. As of last year, the youngest that I've seen in my patient population is a 28-year-old type 2 diabetic, where they didn't know, they didn't take care of themselves. They were eating whatever they want. A lot of American foods, unfortunately, have a lot of sugar in it. And I catch myself all the time. A Coke, a soda, pasta, candy, a snack, even chips nowadays. Anything that you like and taste probably has sugar in it. And I have to first take a step back saying, it's probably what I'm eating that's causing me to be high in sugar. It doesn't just magically appear. Unless it has to do something with your pancreas, right? Genetically. Sometimes it also be family genetics, just happen. But the earlier that you're diagnosed, the better the treatment outcome long term. So you have to accept the fact, even being pre-diabetic, it's a new term that's being used more often than it was 10 years ago. So we were waiting until you were diabetic to boom, change your lifestyle. No, we have a pre-diabetic classification now. So, hey, if you keep going down this path, there's no turning back. You've done the damage. So for me is get tested. I hate going to the doctors too. I hate needles. I hate drawing blood. But even a simple test once or twice a year. 2, diet and exercise. I'm doing it myself. Myself, I am in that borderline pre-diabetic. So I had to change my mentality 2 years ago. Even though I don't eat a lot, even if you eat a little, it's what you eat, and that's what your body has to process. And then exercise. Your body naturally just decreases stress levels, anxiety levels. Get your day started early. So working out every morning is a part of my lifestyle now. I didn't do that last year. I know I wouldn't wake up at 5 a.m. to hit the gym, but I got help. I have a friend. He's a mentor and my gym buddy, and I've lost about 30 pounds in the past 2.5 years. So I'm much slimmer than I was. And then finally, let's say you do have diabetes or just want to educate earlier. Remember us growing up, Colgate, brush your teeth when you're a kid. They would push it for kids in elementary. That is a next step that we have to do in my profession. Hey, be careful running barefooted. You can get warts. You can get a cut. Wear specific shoes if you're out playing, if it's wet or muddy. If you get a cut and then you're in the wilderness or in the ocean, do these little things to make sure it doesn't get infected. So part of it is us teaching the parents, teaching the kids, and that's the strategy that most medicine does.
In your opinion, would you say that we would look at physical well-being before we look at financial literacy teachings in school? Because neither is being done correctly. If you look at the curriculum currently in the schools, both are lacking severely. both health and wellness and financial literacy. And it's something that many parents are asking for every single day, saying, hey, can we get some programs to talk about dieting? It just wants to eat Doritos all day and eat hot dogs and hamburgers and macaroni and cheese and all these candies and sodas. And it's, if they had more education on them, I'm sure they would be doing opposite things. Like we would do the DARE program in 5th grade, and even some districts have gotten rid of that. So like now they don't even have any type of, anti-drug program. So now we have all these issues growing up with kids smoking marijuana earlier than ever before. Me being a teacher, I've seen it like as soon as elementary. And, growing up, I think probably like late middle school, maybe high school. That's when people like really started in that. So it's just like every year it just gets sooner and sooner. And, it's almost scary because it's like, if this is happening today, what's going to happen in 10 years from now if things don't change?
Correct. I agree with pretty much everything you said. It's I see it in my practice is, let's say the husband and the wife come together. The wife keeps telling the husband, you should have done this, 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 and this to avoid your current situation. And I pretty much repeated the same thing, and then that's when it clicks. So sometimes even as a teacher, as a educator, you already know the answers. You tell it to somebody that you're in front of you student-wise, and they still don't listen. So sometimes you have to bring an expert or somebody you trust or somebody you look up to drill it in their head. I can tell somebody invest in this stock versus Elon Musk saying it and boom, it skyrockets, right? Mm-hmm. The difference is you trust him, you want to be like him, and he's got a background and he's got respect. So that is the difference. And it's hard. I know it's hard. So that's why to help with that, I would say have the schools invite doctors, invite surgeons, invite nurses to educate the students directly versus the teachers who are grown adults who know the answers, but the students aren't going to listen to them, or very few will.
And then even out of the community for the schools, I couldn't even imagine like every student saying, I'm going to listen to this doctor and just do what I'm supposed to do. If we look at the percent, maybe, let's be conservative, 30% of the students are going to get something from it. The other, 70% are going to keep doing what they're doing. And saving 30% is not bad because that's going to compound as we keep doing it. So 30 will turn to 40 is going to be the peer effect. So if they see their peers doing it, they're like, oh, you're eating healthy, you're looking good, you're able to run. What's your secret? Oh, I'm healthy. And so now they start to make the changes. And I believe, early education is definitely a huge proponent into what we're going to have later on in life. But sometimes in life happens to us, right? Maybe we're riding our bike, we fall, we hurt our leg or something, our ankle. Maybe we get in a car accident. Something happens where we lose mobility in our foot. Even be maybe something along the lines of a stroke or something. So we lose our ability to walk. So there's so many things that can happen to us, even if we are being healthy, we're doing the right things. But then kind of life comes in and says, hey, just want to let you know I'm still here. And boom, something happens, right? What's the road to recovery for someone who hurts their foot or hurts their ankle?
So great question, because that is a very common question I get every day. It depends on the severity and how bad it is. So if it's a simple sprain, believe it or not, a sprain hurts way more than a fractured bone. A simple ankle sprain, which is very common in athletes or even the big toe joint, you will recover within 6 to 8 weeks, but you will feel a lot of pain throughout the whole time. Let's say the second tier, it's a broken bone, a fracture. Bone heals in 3 months. With or without surgery, it heals in the placement in 3 months. So we have to educate the patient, hey, don't walk on it. Don't put any weight on it. The more you move, the more it's going to grow in the wrong direction. And then finally, if it's something long-term, if it is a stroke, and if it's severe accident causing nerve damage, then that's when you have to be honest with the patient, say, hey, this is going to be a very long recovery, many months, if not years. It's going to take not just me, but a full team, a physical therapist, a primary care doctor, somebody to look at you at home, somebody to take care of you. And then we have to decide if we're getting better slowly, continue. If not, do we have to do a surgical correction to get you there faster? So that's the 3 tier levels. Is it short, medium, or long life, I'll call it.
Growing up, I was spraining my leg all the time. I never had a fracture or any nerve damage, but I would get quite a bit of sprains. I would just, be running, jump or something, and my ankle goes the wrong way. But I never truly understood what a sprain was. I'll get some swelling. Yeah, I'll put some ice on it. But, put my foot in Epsom salt or something along those lines. All these home remedies that we're told to do. And maybe they're effective, maybe they're not. I'm not sure. But what is a sprain essentially? Is it like, damage to your muscle or like bruising of the bone? Like what's happening in it, like during the process of a sprain?
So a sprain, we're looking at the soft tissue itself. Soft tissue includes the ligament, the capsule, and sometimes the tendon. So it's not a bone fracture, so it doesn't need corrective surgery at that time. We usually put in a splint or in a cast or in a boot and let it heal scar tissue over in that formation. So it can be a ligament, which is the most common is the anterior tibiofibular ligament or the ATFL. That's the most common sprain in the ankle. Okay, it's in the front aspect of your ankle. Second, it can be another ligament or it can be the capsule. Capsule tear between two bones. There's something holding it together, surrounding it like a bubble. It's called a capsule. So it holds in the synovial fluid to allow you to move. And then finally, on top of that is the tendon, which when the muscle contracts, it moves the joint. So those are the three levels of what is a sprain. It's soft tissue, ligament, capsule, or tendon, depending.
Working through an injury on your foot. For example, you get hurt during a basketball game and you say, Coach, I can still go play, right? So maybe you tape up your ankle or something and you still play on it. I think of the race for David Goggins when he ran the 24-hour race and he broke, I want to say all the bones in his foot, but I don't know if that's possible. But he broke some bones in his foot. And so, but he was still running, and what he did was he just roped it together, tied it up, and he was able to finish the race. But to what level? And then he talks about in his book too. But like the recovery process to that. But many people don't look at something that's immediate, like, oh my goodness, like I got a nail in my tire. Oh, it's still fine. I can still drive on it. But sure enough, you keep riding on it, eventually you're going to have some issues. And I can imagine that being very similar to your foot. If something is going on with your foot, whether it be, you got a pain somewhere, you're like, oh, this is normal or something. I'm 50 now, like this is normal. Maybe I walked a little bit too much hiking. This is normal. So, we basically push through the pain. What would be the consequences to do that or from doing that?
So what we've learned in the world of podiatry and orthopedics is that there is something called post-traumatic arthritis. So any little misalignment, just any little glitch will cause the ankle joint to be not in the proper position, kind of like a hinge that's slightly torn off. Over time, because it's working in the wrong place, it's going to wear out the cartilage, increase inflammation, and overall decrease the joint space, okay? Leading to arthritis. That is the ultimate issue. So you'll have all the symptoms. My ankle clicks. My ankle keeps rolling in. Now it hurts every step. Now I can't put any shoe on. Okay, now every day it hurts. What's wrong with me? Well, it's something you did probably 10, 20 years ago.
And then what would be the process? Would they have to reach out to you saying, hey, this is what I'm dealing with, and you have to do a full inspection of everything that has been going on? Or is it something that you just say, just take some Advil and, hope and let's hope for the best or something?
So with that, let's just say the ankle sprain, I always give three options to the patient, three recommendations. One is a conservative, so resting, icing, physical therapy, and oral medication. Option number two, it can be an injection, the most common being a cortisone injection. Nowadays, you can also offer stem cell injection to try to rejuvenate the cartilage in the ankle. Option number three will be surgery. So surgery is always the last answer. We never try to do that first. And the surgery would be usually 3 levels as well. A washout and a clean out with little cameras. It's called arthroscopy. The second level will be an ankle joint replacement. So if you heard of a knee joint replacement, we do those for the ankle as well. Then the third level, if that all fails, it's a fusion. So we would fuse the ankle joint. You'll never be able to do this again. So by having no ankle, you have no pain. That's the idea.
Would you say, I know this happens quite a bit in sports, like they'll, like tear something and then they'll have to go for surgery. Sometimes they're out a whole season, but then they are still not out of the game yet, right? So they're like, I'm coming back next season and I'm going to be better than before. Do you, like in your experience, like looking at the x-rays and things, do they come back better after the surgery?
I've had a few young athletes that I've done surgery on. They do come back, but not 100%. They always come back either 70, 80%. One, they feel that they had the surgery. They feel something's different. Two, you're always changing the mechanics. So the injury itself changes it. Your goal is to restore it as much as you can. And then finally, performance. They don't feel, can sometimes be a mental thing. They don't feel unstoppable anymore. They feel guarded. So those are the top three things that I've seen.
What would be the factor for old age? Because we know in time things can become dilapidated. If you leave a house, for example, just sitting there, it's going to fall apart. If you're not upkeeping it. As you grow older, right? Maybe you're in your 60s now. There's things that need to be done, like proper foot care, or as you talked about early on, dietary things that have to be looked at also. What are some of the things that people can do, in their later ages when they start to have symptoms of not being able to walk well, upstairs, etc.?
So I'm a big proponent of keeping healthy, staying active. My grandpa, he's 88 years old. He still walks. The research that I've read on podcasts, audios, and even books is that you want to have a lot of fluids, always be hydrated. A lot of I want to say, is it 70% of the body is made out of water? So naturally, as you age, you have less water in you. The most common thing I tell my elderly patients, my foot hurts, is like, yeah, you don't have fat on the bottom of your foot. You're walking right on your bone. The fat is pretty much slimmed down. That's your knuckle of your bone. You're walking on the knuckle. So 2, staying active. A recent podcast I was listening, you want your legs to be the strongest thing in your body. Legs we're going to keep you walking, keep you moving, and going up and down the stairs. My grandpa still lives in a 2-story house. I think that's what helped him and saved him, because he's always exercising. Even if it takes him 2 minutes, he's still going up and down the stairs, pushing that oxygen output and circulation all across his body back into his heart and all in and out, in and out. So, and then 3rd, finally, if you can't walk no more, go see a specialist. Is it loss of fat? Is it a nerve? Is it poor circulation? Did you have a fracture and didn't even feel it? So that is very common as well.
I want to make sure I got this right. Did you say the leg should be or is the strongest part of the body?
Should be.
Okay.
Your
With
thigh.
the should be aspect, do you think people, we know people can overtrain, but do you think people should try to overtrain their legs?
I've done it and I get injured. So
yeah, because if it should be the strongest, you should probably do it 2 or 3 times a week or something.
So I exercise it twice a week, and then I replace running as a 3rd time, or walking even.
Okay.
Yeah, and you can't overtrain.
People have been talking about running recently. When I was young, I ran, and when you're young, you can do a lot of stupid things, and you're good, typically. At least for the time being. But today, like, I would rather go hiking. I do steady state incline. I'll use the bike. I'll do jump rope. All of these things have less impact on my knees. And even though, like, I don't have any issues, I understand if I keep doing it, I will have problems later on. So I do things that are, less abrasive on my knees and on my legs, even though I will still squat and I'll still leg press heavy, but it's, all because I've been training for the past 20 something years now. So, I built that up versus like day one, let me go, try to squat, 500 pounds or something like that. That's how we get hurt, right? You hurt your back, you hurt your legs, something goes wrong. But is there a better form of cardio than walking if we want to really strengthen our legs?
Incline, I'm a big proponent of incline. depending on your age level, right? The second best thing will be the Stairmaster staircase. Honestly, you don't even need to do that many minutes on it. Some people say, "Oh, I did an hour. I'm sweating." Yeah, but then you're eating an IHOP the next couple minutes. So staircase, master, and the incline definitely help with that. If you don't have that at home or don't have availability, going down the street or trying to do an uphill and then downhill, that's just as rigorous, especially if you're 60, 70 years old. Walking definitely pushes you to keep on moving, but you have to train depending. Do you want to lose weight? Do you want to stay active? Or do you just want to feel healthy? Okay, those are three different layers, three different mentalities. But as long as you keep moving, there's no reason why you should decrease. Okay, if you're just sitting at home, I think I wrote a paper when I was in high school. I remember how many hours in a day does an adult actually walk? Um, I don't know. It was my senior thesis in high school. I don't know what I'm remembering now, but I somehow convinced my teacher that the most is from the parking lot into your office, because pretty much all day you're here in our room with our students walking left and right, barely any movement, sitting in a chair. During lunch, maybe you go to the teacher's lounge. And after that, you go back to the parking lot, go to your car and go home. Some people, that is the most exercise they get in a day. So how do you think about that?
Remote work now, and from the pandemic, like how many people just stayed in their homes and just behind their computers. So life has changed so drastically. I even remember like they closed the gyms down for like 3 months or something, or like I don't know if it was longer, but they basically said you can't even go to the gym, and if you want to go outside, it's only for exercise. And I looked outside and there was no one out there, and I'm running around the block because my gym is closed. So, and I have some weights at the house and things like that. But fitness during those times, like people were so afraid to get sick that they said, you know what, that can take a back burner, for now. What would you say would be the repercussions to that mindset or to that era where many people became remote nomads and remote workers and stopped even walking from the car to the classroom or from the classroom to the teacher's room? What would be the repercussions if people don't change that today?
So easy enough: decrease mass and muscle, increase weight. For men, it's usually in the stomach area. For women, it can be in the glutes. Hunchback more because it's used to not being vertical. So decrease in height, less oxygen usage. So your body's not working hard. Your heart tries to adapt, and your lungs maybe even adapt as well. Not sure if it gets bigger or smaller. That's not my profession. But it's essentially your body is an amazing adaptation. And if you use it less, it will require less and you will be less. So, and long story short, you might live.
It's scary, for people to think about certain things in life like that, because I can't imagine any person thinking like maybe in life I won't be able to walk again. And, as we said, there's a progression, like from being, from a young age to understanding the education beyond this. Then when you have the ability to do something, are you doing it? And then when you get older, are you still being diligent in that? Because, life is always going to throw you a curveball. It's always going to give you something to worry about, something that's going to get in the way. I can't tell you how many people start a fitness journey and they end it, and then they kind of become, those couch potatoes or something along those lines. And I'm not saying that if you are in that situation, you can't change, but you do have to ask yourself, like, do you want to be doing things later on in life? And one of the things I see quite often with people who finally get grandkids in their 50s and 60s is they have the all, same idea of wanting to be able to run with their grandkids. They want to be able to chase them, to play with them, to lift them up. And it might seem like something that is so insignificant, but to them is everything. And they will do anything in order to get it, like to get that mobility back that they once had. And, sometimes it could be a lost cause. Sometimes it's something that can be doable. I remember my grandmother, she wanted to get her mobility back. She's 78 or something now. And she went to one of the gyms. And the gym said, "Oh, I can get you walking again." I was like, "Don't believe them," because I was like, they're a personal trainer. They might help you lose weight, maybe your nutrition, but you need to see a specialist if you want to get your walking capabilities back. You need to go see someone who knows what they're talking about. And and then she was like, "Okay," versus like, "Okay, I'm gonna go to this guy who says, like at the gym, who's like, I can make you go and he's gonna give you the top membership plan." You have to, do your due diligence when you're seeking professional help. And one of the things I love on, for coaching a session is I already do all the vetting work for for the audience. I make sure that the person is legitimate and make sure the person is not only skilled, but will also care for their patients, because I have found the people who can care for someone, the people who can, not only look at a patient for, just another person, but for someone that they can help. It makes the biggest of the differences in the world, because even for my coaching, it's not so much of, like what I can get, it's like what I can give. And I think, Dr. Santos here, he can give so much to, anyone listening, anyone who's in a situation or circumstance right now. Maybe, a loved one who's going through a recovery process and they might need another consult, because I can't tell you how many times the doctor, even though they mean well, will say, "Yeah, you'll never walk again. Yeah, yours could be in this situation, could be in a wheelchair for the rest of your life." But then I think back at the story of Dan Millman. I've been using the story quite a bit. But Dan Millman, he was a Olympic gold medalist. He won. He did the rings. He was in a motorcycle accident. He shattered his femur. So the doctors, his coaches, everyone said he can never do anything again, and he'll be lucky if he could walk with a cane or a walker. And sure enough, he found someone who cared, someone who believed that he could do it. And sure enough, what Dan did? He went out and he won gold. And so that's what we can do in life. We can go out and we can win gold, but we need the people. We need people that are going to, be our biggest cheerleaders and our biggest supporters. And, our conversation today was definitely one of education. It was definitely one for an understanding of what could go on and maybe, some of the simple fixes. There is no simple fix when it comes to your health and fitness. You do have to ask for help. And, here in coaching session, we humble ourselves and we ask people for some guidance. We ask people for some help. And the conversation was definitely one of those. So as we begin to wrap up, Dr. Santos, if you could, please share with us some final words. And then please share with the audience how they can reach out to you and find you.
Yeah, so don't be afraid to go see a foot and ankle doctor. We are very relaxed, very clean. We're here for you. We want to learn what you want to accomplish foot and ankle wise. We want to get you back to that standard. If you're an athlete, we can get you to what's comfortable to perform better. If you're the day-to-day person, we want you to keep moving. If you're just a regular worker that's having trouble standing for long periods of time, we have options. We have ideas. We have things over the counter that we can offer. So don't be afraid, because we always try to get you from point A to point B in a good time as possible, and trying to help you. And essentially, we always help even your own family members. Essentially, long term, we always see everybody. We don't give injections on the first day, so there's nothing to be afraid. And then surgery is always a last answer, at least in our minds. We always try to conservative. So medicine has evolved. That doesn't mean that the basics still work, and that's what we try to strive for. Something as simple as a cream, as a technique, as a change in shoe, can go a long way. So, and we have that knowledge for you. And then if you want to find me, I have a new website, drdelosantos.com. I'm also on Instagram, Dr. De Los Santos, and on Facebook and LinkedIn. So I want to thank you, Michael, for having me, and thank you for this great conversation.
Of course, and I'll make it easy for everyone. All the links are going to be in the description box below. And I know people are going to say, "Oh, where are you based, Dr. Santos?" Well, he's in North Houston, but it doesn't mean that you can't give him a call. I'm sure he does Zoom calls, things along those natures, Google Meets. So telehealth, so you can just ask the questions, begin the process. And, we have made such huge strides in the medical field. I remember, it was just a couple of weeks ago, they were like, "We're closing all the offices." And sure enough, they're like, "But telehealth is open." So it's like, it's always someone there that's able to help. wherever you are in the world. So if you have something that is wrong with, with your foot or your ankle, if you know someone who can benefit from a second opinion or just advice in general, again, check out those links. You could do your own research, and then when you're all done, you're going to find yourself giving Dr. Santos a call. So I do want to thank you, Dr. Santos, for coming on and spending some time and talking about your work today.
Thank you so much, Michael. Appreciate it, and I will look forward to anybody who has questions.